Immense pleasure in welcoming you all for today's Learn Together session, which stimulates our mind with a recharge and prepares us for contemporary skill set. I am Devi Sangamithra Viswanathan from BSMED 2004 batch and currently pursuing PhD in Finance from BSMED. This is a successful session by our BSMED Alumni President, Mr. S.M. Shankar, and coordinated by a team of alumni members. I extend my sincere gratitude towards the Director of BSMED, Dr. Rupa Gunaseelan, our senior faculty, Dr. Venkatapati, Professor Ramki, and other faculty members for providing immense support in conducting this everyday knowledge sharing program with their valuable inputs through participation and encouraging towards more varied thoughts. I also welcome Dr. Madhan Kumar, who is the speaker for today. This session, during this pandemic situation and isolation, some of us are perplexed amidst pain and illness and are feeling helpless to reach for medication. We are here to know about the contemporary treatment method online. We are highly privileged to know and listen and get valuable inputs through interesting topic, No Pain, and Start Living Your Life. I'm happy that founder and director for Shriya Pain Care Center, Chennai, he has 18 years of experience in the field of medicine and holds multiple responsibilities as the clinical lead and senior consultant in the Department of Management, MGM Healthcare, Chennai. Also, the group director and senior consultant for Department of Interventional Pain Management and Anesthesiology, Gleneagles Global Hospitals, a Parkway Pantai Enterprise, India. Dr. Madhan Kumar has completed his post-graduation MD training in anesthesiology from prestigious Annamalai University, India. Peripheral nerve block was his main area of interest during his training period. He has presented scientific papers in various learned societies, which has earned him many laurels and awards. He was awarded the best outgoing student during his training tenure. Over the course of time, he developed a keen interest towards chronic pain management, especially cancer pain and back pain. He has worked in Maldives, Australia, and pain management fellowship from Aintree University Hospital, Liverpool, UK. He is the first physician in Chennai city to start an independent pain clinic. Furthermore, he is also the first pain physician in the country to apply robotic assistance in interventional pain management. His innovation and holistic approach to patient in combating pain was vividly appreciated by various professionals from the medical fraternity across the country. His paper was awarded the Best Innovative Paper Award by Society of Intervention Spine in Florida, US. His vision is to develop a standalone pain management hospital to cater all walks of life in near future. Welcome you, sir. Before we hear from the speaker, there is a quick video clip for us to have a glimpse of what the medication is all about.
Thank you, Sangamithra, for this wonderful introduction. If anybody having any technical glitch, please stop me in between. I will stop for you and then we'll reconnect again. Good evening, India and Asia, and good morning to the other part of the world. I'm Dr. Madhan Kumar, pain management consultant. You might be wondering why I'm here when there is a big pandemic going on, novel COVID-19. But we all forget that there is something even worse than that, pain. Pain is something which caters to almost 80% of the population, worse than a COVID, and people neglect it for not treating it. And they live with pain and they think that is their fate to live with pain. I don't think so. That is true. And I'm here to just make you aware that there is something called pain management. This whole topic is into no pain. So I'll put it as KNOW, it is NO. I'll put it as NO pain. So it is no pain. And that is what I'm here to talk about. What made me interested in pain management is when I was doing my house agency, that we call it as CRRI. After final year exam, we have an internship in the hospital. So I was posted in the medicine ward, and we had a patient with CA stomach who was finished all his treatment, and old-aged man. He's a 62-year-old and survived by wife, two kids. Kids were all big, they are all working. So the wife used to get food and come. He used to always have a smile on his face whenever he sees us going for rounds. I was very junior at that time. So I used to go for rounds with my professors, assistants, and we used to inquire what it is. He used to say everything is fine, but only thing I'm not able to get rid of the pain. That was his only complaint. So he never bothered about his pathology or whatever the disease he was having. He said, please get me out of this pain. So every day his medications was increased, medicines was given. So we had very limited medication at that time in 1999. So his pain was not controlled there. And all our professors, whatever they had learned and whatever they could do, they did their best in giving medicines. But his pain was the only one which was really troubling them. So after 15 days, there's always a rotation. So I was posted to another department where I couldn't follow. This made me really think, why should this patient suffer with pain for no fault of it? The disease has come to him, but where are we? Why are we not giving any pain relief for the patient? Very nice patient, very nice patient, very nice family. And he only asked us, request us, and now it is his demand that he needs a pain relief, which we are not able to do. This made me interested into pain management and started researching into pain management when I was doing my post-graduation. So peripheral nerve blocks, I could stop some pain with the peripheral nerve blocks. That's why my interest in peripheral nerve blocks was very keen. I used to do for adults and pediatrics, where at that time we had very limited gadgets. So it was all anatomy and landmarks where we learned our techniques. From that, we slowly moved into other gadgets like ultrasound, and we use fluoroscopy. These are some of the things which help us to do the pain relief for the patient. But still, I wasn't still convinced whether we are in the accurate direction or not. So this made me do more research on pain management, which started my interest. Though I'm an anesthesiologist, basically, my interest was more into pain management. So we started researching into this and finally came up to what was it today. But this is not going to end here. We'll be still researching more, and it's evolving. Every day it's evolving. Every day it's evolving. This pain is very complicated subject where people are, even our olden literature has nothing on its book. So first I like to talk about what is pain. So you guys should be able to tell me what is pain. So pain is something which is an unpleasant feeling for everyone. Even the word pain, which makes you sit upon of pain. Somebody's having pain, I wish I don't have pain. So that is what our thinking always is. So pain is something, a very unpleasant feeling in our body. But again, what causes the pain? So there should be some cause for pain. Like there should be some pathology, or there should be some fracture, or there should be some tissue which is getting really bad. So that is what is going to give us pain. So this pathology, if it is really taken care properly, or the disease which has been there taken care properly, can get rid of the pain. So that is where the pathology needs to go. Okay, now coming to what are the other types of pain, what you can think. You should definitely, I think everyone in our life should have undergone some pain or the other. For example, headache. Headache, yes, definitely, which commonly somebody goes, or somebody with the knee pain, somebody with the back pain. So pain can come in various factors. So I can classify pain into two. Just for your understanding, I'm just telling you it's acute pain and chronic pain. Acute pain is very sudden onset. It just pops in, and it can be due to any injury, it can be due to any accident, or any it can be due to surgery. So these are acute pain which can be caused, which eventually comes in a week or two. But chronic pain is always which pain evolves more than 3 months into. Even though you take medication, it is not, or you take some other form of treatment where you think you can get rid of pain, it doesn't leave. So any pain more than 3 months need to be definitely evaluated and to be treated. It is not that we cannot treat pain. Now the situation is different. We can definitely treat pain. You might be, as I said, you might be wondering why I'm talking about pain and not talking about COVID. So I will come to that COVID topic at the end of my talk, because I know you have heard a lot about COVID, the news, and the speakers around us. So I will be talking about this COVID. Don't worry about it. But during this lockdown, where are we? See, a lot of people are not able to attend their pain management clinic because they couldn't go out. This is where I thought, and we went into a forum and we went online treating patients. So our company, which was a startup, was a Shaya Thinker, which we said, okay, let's start giving something for the patient online, and we are doing whatever consultation or even treatment like physio. We have two people at home; they can help them do their physio with the help of online physiotherapist, or if they're okay, we can go with yoga, we can go with meditation, mindfulness. We have counselors, we have so music therapy is another part of it. It's all holistic approach. Again, I don't go with just giving tablets or injections. It's all holistic approach. And apart from this, everything we go treatment part is robotic. So robotic is something new to the whole field of medicine and pain management. And what we do is it is very accurate in giving the injection. So injection, everybody is thinking to see if there is injection. People have whatever in mind is giving steroids. Always people ask me, is it a steroid which is going what we are going to give there? Which is not true. So no more steroids are given. It's going to be a long-lasting anesthetic agents with adjuvants which can stop the pain. So this is what we're going to do. And when we keep doing this, it can be 2-3 sitting or it can be one sitting, whichever it is. It can be with robotics. So this will enable the patient to get rid of the pain and increase the quality of life. Ultimately, this is what we need. We need to improve the quality of life for the patient. Patient doesn't have to sit at home. Somebody is having an 82-year-old lady coming to me with knee pain and tells, doctor, do something to get rid of this knee pain. So the husband sitting next to her says, no, you're not going for any marathon or anything. Wife very clearly says, no, see, I just want to do my household work, have some social life. This is what is a quality of life they want. And see, there are various causes for this pain. So what I told is initially, so we need to find the pathology. So what is the cause for the pain? Try getting rid of it. So it is a multimodal, multi-departmental approach. So it is recognized as a 34th specialty in the US. It is only a matter of time that it is getting into India. For the past 5-6 years, it has been into India, and people are coming to get more aware of it and try to treat themselves for pain management. So when robotic came in, people are really not too much into it, and then the effect was very good, and people said, okay, it is really good. Let's try this. For my friends who are staying in US, I'll always say they will be aware that pain management is a very specific field for them, because insurance does not cover a patient going in for a surgery, spine surgery directly. The insurance will say, please go through pain management program, then come to surgery. Then if it is not okay, then you go. It is only a matter of time. So we are going to save money. You're going to save a lot of time, a lot of energy. Only a matter of time. It's already in India. A lot of insurance companies are approving this, and I think very soon the consultation also will happen. So as this procedure doesn't need any anesthesia, it is all going to be local anesthesia. Whatever it can be done with local anesthesia, unless the patient really think they want to go have a good sleep. Otherwise, it's all done in all a daycare. Patient can just come in the morning, go back in the evening. We have seen a lot of patients coming in having a severe pain in the back and crying and coming. So for them, when we do this procedure, we have seen them sleep on the procedure table. So they haven't slept for so many days because of the pain. This is what we want. We want the patient to be benefited for pain management. For no fault of theirs, they shouldn't be suffering. So as I said, it's very simple process. It won't take more than 20 minutes for the 30 minutes. Patient is awake. We keep talking, or they can listen to music. Go ahead with procedure. Okay, I'll just touch on some examples of what all pain management patients we get. For example, patient coming with facial pain, one side facial pain, so it's not crossing on the other side. So we do all the investigation. We find clinically what has happened, and this is something called suicidal disease and trigeminal neuralgia. That's what it's called. And this disease is very, very, very dangerous, and no fault of theirs. It can be various reasons why they get it, and it cannot be any reason also. So these patients come to us, they cannot brush, they cannot take any food, they cannot take any liquid. They come to us with various kind, and so all right. Once they come to us, we examine, we try to block the nerve. Again, when blocking the nerve, people always ask us, if you block the nerve, will they not get any relief, or will it not come back, or will there be any loss of sensation? No, we block only the pain nerves which is happening there. So this is not something a new technique. It has been followed everywhere in Western countries, but slowly it is getting in. So it is not a trial and error technique which is followed. It can be done in a very simple procedure. So once we block this kind of pain on the face, the patient is relieved of the pain. So happy. See, you're giving a patient, human being to the family. You're giving somebody special to the family from pain. Always have done something to them. So this is what the quality of health we are trying to get into. So when people come to us, suppose for example, shoulder pain. Shoulder pain, there'll be a lot of causes for shoulder pain. Can be some injury, sports injury. You might have lifted something badly. There's so many factors of shoulder pain. So these kind of pain can be corrected with the. See, that's why I said it's multimodal, multi-departmental approach. Can be an ortho issues also. Yeah, we get an orthopedician to see the patient and try to get rid of it. And the major cause for the youngsters now who are having when this lockdown period is neck pain and back pain. We get so many calls and so many video calls from patients who are, because they do not they do not have a proper ergonomics. They do not perform a proper ergonomics, and when things are uh, is my voice audible? Somebody can respond. Is it audible? Is there any issue with the audio?
Okay, but you can be little more louder.
All right, all right. I'm sorry about it. Sorry, everybody. I'll be a little louder. So common problem I was telling is now the neck and back pain. So people lie down and watch their computer. People sit in an odd position at home. See, they don't follow in a proper ergonomics. This happens even in office. It's mainly with IT people or work from home people. So people when they're doing with the computers or the system, we need to follow proper ergonomics. These are simple things, but we forget. We forget when there is something going on, where we have a deadline going on, we have some meet with our boss, we forget all these things, and we don't take proper precautions, we don't take proper preventions, and then you land up in severe pain. And so all these can be corrected. So these are some of the examples of pain, what is happening. Another example of pain of common useless is knee pain. Knee pain again can be various causes. Causes like osteoporosis, bone can get fragile when you get old, which is common. Bone will definitely get old, and that's common. See, all these things we tell them to have a proper physio, proper exercise, proper walk, which they cannot do. Once we get this position, then they'll be at least able to do all that, and we can get things going on with them. The most common complaint patient coming to us is a headache. Headache has some 15 causes. Uh, the worst thing is people or patients going to the pharmacist, getting a over-the-counter medicine, trying to pop in every time something happens without finding what is the cause. definitely don't do that. Please consult a family physician or consult a physician who can be treating you. Try to follow the advice. Problem with having your own medications or buying a over-the-counter medication is, on a long run, it is going to harm you. It is going to harm your body. It's going to harm your liver. It's going to harm your kidney, because this is where it is metabolized and excreted. So you will have all these problems if you're going to self-medicate without knowing what medication you're going to. All medication will not suit you. So few medications. So please ask your doctor how you can be treated with pain. Never take self medication, which is going to be really tough on you. All right, so these are the few types of pain I told you, and the latest one what we can do is doing the pain management at home. So online you are heard of me talk. So whatever we do the hospital, patient cannot move, patient cannot move from the bed, patient want a pain relief. Yeah, we go visit them at home. Of course, not now since it is a COVID lockdown. Before this, we were doing it, and after this, yes, definitely we'll be doing it. And we have again a teleconsultation with the doctor who goes there and try to do what the best for him. Yes, sir. We are coming up with a prototype of a robotic being shifted there, getting a procedure done at the bedside. So this is what we are going to evolve. I know there'll be a lot of students from VSMAD listening to this, apart from alumni, which they need to follow, right? Always try to go with your dream. So my dream was to get a pain-free world, which I'm trying. So whichever hospital I was working, I was trying to make a zero pain hospital. So from the emergency, when patient comes in till the patient is discharged, we want to make them zero pain. So that takes up all the fear. So you're telling going to hospital, everybody gets fear and the pain starts more. You get more of heart rate goes up. Everything happens, and it's called something called white coat syndrome. All these things happen. So now we are cutting down all that. So you just have to on your mobile, on your laptop, and try to get your consultations online. So this is what we are trying to do. I think I've almost touched up everything. Hopefully, I have not left anything, or I'll open up for questions and let it be more interactive. I like to talk with everyone, clear your doubts, rather than me alone talking on just subjects. So, and one last thing I want to mention is prevention. So you don't have to go in for treatment always. There's also prevention. So for spine, please take care of your spine. Don't allow it to get ill. Then come to us. So if you really want to take care of your spine, do your regular exercise, take adequate hydration. All this are regular thing. So don't try to lift anything very heavy. I know one patient recently when I saw him who's having a young guy, 29-year-old, who's having multiple disc collapse. Around six disc collapse he is having. I asked him, what did you do? Then I lifted weight in the gym. You cannot become a real tough overnight. You got to go slowly, develop your core muscles, develop other form, and then go slowly. So this is what will happen. You will hurt your back. So always prevention is better. Like I said, even sitting, you can't sit in a odd position. You're going to hurt your spine, or you're going to hurt your back. You're going to hurt everything. So this is going to get impact on your life. So once your spine is hurt, then you'll be very difficult in rehab. Lot of things will happen. So we can't get rid of it. But why do you have to go for it? So I always advise all the listeners here, try to do prevention. Take care of it. And do a healthy exercise. Have a lot of water. Hydrate yourself. A lot of people don't do that. Hydrate yourself. Have healthy food, healthy lifestyle. You'll be absolutely fine. I'm open for questions now.
Yes, sir. Yeah. Participants, now you can have your questions, suggestions. You can unmute yourself and you can start having the questions.
Yeah, hi Sumi. I got a message from you as a question. Yes, see, back pain. Yeah, back pain definitely is concerned with your posture also. Weight loss will definitely be good. The weight loss will definitely be good, and not necessarily it should come come only to unfit people. It can happen. I told you this boy, 29-year-old, very fit boy. It can happen. So there are various causes. We need to see what is happening, and then we go. I tell you, for back pain or neck pain, swimming is a very good form of exercise. And if people can learn swimming and try to do it, see, these are all prevents you from having medication or injection. So I can tell swimming is a very good form of exercise.
Sir, I'm Sangamithra.
Yes, ma'am.
Sir, I want to know about cure for migraine when I have a
Alright.
neurological problem.
Okay.
Okay. Is there any cure for migraine, sir?
Definitely cure for migraine. See, migraine is a broad term. Migraine is a very broad term. I told you, there are almost 50 causes for headache. So we need to find what is the cause. They call cluster headache. It can cause, even your neck can cause you a headache. So there are various causes. Your eye power can cause you a headache. Sinusitis can cause you a headache. So we need to find what is the cause for a headache. And there's something called a diary. If you think you're getting headache regularly, there's something called, you need to write on. Even it can trigger any out source can trigger your headache. So we can call it headache till we find what is the cause for it. So people generally tell it's a migraine. So we need to find the cause, but then we can get rid of it.
Can we get rid of it permanently or just for the?
We can get, if you know the cause, we can get rid of it permanently.
Okay, that's nice to know. Thank you, sir.
My pleasure. I'm sorry, still my audio is problem. Is it okay? Yes, Swami? My audio is okay? I can see your message. You're not able to hear me.
No, it's fine. Swami sir, you're talking, I think, but your audio is not. Just a minute, sir. Sir, we have our former director, Dr. R. Venkatapati sir, online. Sir.
Yes, sir. Good evening, sir.
Good evening. Nice to hear painless talk.
I don't want to put all your people into pain. I'm a pain reliever, so I made it very simple.
So one thing that everybody bothers about is back pain and the joint pain. Very frequently people talk about this. I'm a layman. I am not sure whether I know all these things, but I'm just clarifying one or two ideas. And when we say this back pain, especially people say, whenever I bend down, the portion that is the end of this, what do you call, all the, I mean, this final port, L1, before let. Okay. Now, when they say, is it because of some other functions that in the intestinal activity, something is going on, wrong position of these things, or is it something really a botheration?
Sir. All right, sir. So spinal cord is something which carries all our nerves from the brain. So it also carries, suppose there is pain in the stomach, it carries nerves from the stomach through the spinal cord and it will tell the brain, come on, something is wrong in your abdomen. So this is a circuit. So suppose somebody is having appendicitis, he'll definitely have pain radiating to the back. So you'll always tell it is radiating to the back. But if the spine alone is getting injured or spine alone getting some insult on it, it will cause pain directly. So then suppose there's a disc bulge. People are traveling now, that youngsters are traveling for a long time on bikes and they come to us with a lot of disc prolapse and things. So they say it is pain in the back radiating to the leg. So this is what we get the complaint from. So these are very clearly that disc is not being taken, disc is insulted. So disc is like a shock absorber between two spinal bones. So it takes care of the whole weight of the body. So it's like a building, it doesn't stand on its own. There is some shock absorber. When that gets compressed, that start compressing on the nerve. So it has both, so the pain carrying nerves and pain giving nerves also. So that's why I said we need to take care of our spine very carefully.
Nice. Only one supplementary question.
Sure.
One of my friends who was working elsewhere in Andhra, he's a diabetic. and he started saying that he cannot lift his right hand.
All right.
And because that shoulder pain is very much, and probably with a lot of medicine and all kinds of this physiotherapy, everything, he says it still persists. And sometimes it goes, but again it comes back and sits on his shoulder. Is it anything to be bothered very much, or it is a natural phenomenon?
No, it is not natural. It is caused, this is called diabetic neuropathy, where it is caused due to diabetes. So he need to have his sugar under control, and he need to do his physio. And if physio doesn't work, we have injection for it, where we can give at that place where he is having this nerve, which we can trace out that nerve, give that. So he'll be relieved from the pain. So you can do is keep doing his physio regularly. So this is common, sir. All diabetic patients come with this hand pain, leg pain. They come with this diabetic neuropathy. Your nerves get numb. So that's why I said before it comes to do, the prevention will be better. Even if it comes, keep it under control. Always sugars, keep it under control. Yeah, then you can keep doing it. It doesn't have to suffer with pain. We have medication for all this.
Only one small information. When we say pain, immediately they go kill it. Painkillers.
Yes.
But when we say that don't take it, that is only harm you, many people are not listening. Even some, I'm sorry, I'm not saying doctors are at fault, but doctors are prescribing for the benefit of the patients.
Yes.
Is it really necessary that we should take painkillers?
Not necessarily. So in this world, people come like they want immediate relief, like a fast food. They want immediate relief. I'm going to a doctor. I want relief. They demand it. That's no fault of theirs. See, who are examining doctor will always know what is best for themselves. But painkiller, yes, 1 or 2 days fine. But on a long term, definitely it is going to harm you. It is going to harm your kidney. It is going to harm your. I was worked in an institute where they are liver transplant was in a big run. So we have come at least 5% of people abusing this pain medication with liver failure. So we have to do a transplant for them. So this cost is going to go up. See, those are the things people should be aware. Never misuse medicine. Don't go to the over the counter and try to get medicine. Take your help of a physician. Prescribe whatever you prescribe. Yes, go ahead. If your pain is done, please stop it. You don't have to continue it for a long time.
Final statement. I asked all naive questions. You gave me a wonderful response. Thank you.
No worries, my pleasure.
Somi sir, next, do you want to have?
Right now, thank you.
Sir, you are online, but voice is a little low.
Right, nothing.
Yes, sir. Yeah.
No further questions. Thank you.
Hi, Swami. How are you?
Fine, doctor. Thank you very much.
All right. Take care.
Thank you.
Jayalakshmi, madam, you are on.
Yeah. Okay. So good evening. I practice yoga regularly, and I started doing yoga like about 4 years ago. So my first 1 month of doing yoga I was in pain in every part of my body, and I thought my yoga teacher was trying to kill me. But I didn't go in for any medicines or anything, and the pain just went away naturally when the muscles got strengthened from the yogic practice. But right now sometimes I have like on my knees or my back, my hip, I have a slight pain, but I don't do anything about it. I'm just expecting it to naturally go away. So do you think that's the correct approach?
Perfect, ma'am. Perfect. See, this positive thinking is very much needed. See, since you are doing yoga, you don't have to worry about anything else. All this pain will go off. Yoga is another form of doing physio with breathing. That's all I tell my patient. Most of them cannot do it. But when you're doing it for so many years, please go ahead and keep doing it. All this pain will disappear. Don't have to worry about it. Keep thinking positive. It'll all go off.
Okay. Okay. Thank you.
No worries.
Any more questions? Yeah.
Yeah. Good evening, doctor. This is
Say this, sir. Yeah.
from
Sir,
Bangalore.
it's not audible, sir.
Okay. One second, please.
Sir,
Yeah,
no, the audio is very, very low.
Okay. Am I audible now?
Yes, yes, sir. Yeah.
Okay. Yeah. Good evening, doctor. I just had a very basic question. what are the right postures for lying on the bed when you go to sleep? One, under normal circumstances, which is the most preferred way, either sideways or on your back or on your stomach. And if you have lower back pain, perineal, because of driving or due to whatever, then what is the recommended posture for a normal lying down position?
All right. See, generally lying down posture is supine. That is with the tummy facing up. You lie down on flat with tummy facing up, not towards the bed. Don't go to the prone position and lie down, which is going to hurt your spine. So any flat position with your tummy facing up is good. Try to use very minimal or a low thickness pillow, which can give you a good relief for your neck too. And sideways, if you're going to do right side or left side, that in your sleep, you cannot really think which side you're going to lie down, how you're going to lie down, just comfortable. But please don't roll around and again lie down on your tummy. So that is a very bad position, lying down on the tummy. But any position other than that, and when you have a back pain, when you have a long drive, always try to lie down on the floor with a mat on. Lie down on the floor for some time, at least for half an hour to 15 minutes. If you can lie down on the floor, it will give you a very good relaxation for your back. So you don't have to do anything else. Still, if the pain is more, just keep some ice pack, and that will keep reducing all the pain on your back. And try doing this at home, and you'll feel definitely better.
Okay, right. Thank you so much.
No.
Hello, doctor. This is Shankar. How are you?
Good. How are you?
Fine, doctor. Doctor, I have a question. See, sir, not every day, but most of the days, no. Sometimes I have a pain on the big toe. Is this any symptom or something like that? Only on the toe. When I actually, while I'm walking with the shoes and all, I will not realize it. But when I remove the shoe and I'm trying to walk on my barefoot, no, when I press on the big toe, sometimes it pains, either on the left leg or on the right leg. It varies on some days.
All
so is that a particular symptom or any indication?
Okay. With whatever the minimal history you gave, because the public you can't give more history. So one is from your back. Either you are straining your back, which can radiate. The other one is uric acid. If your uric acid is more, there can be pain on the joint, especially on the big toe. So if you can check your back, try to do a rehab for your back, and we can rule out what is the cause, try to treat it, and we can get rid of this. So these two can be only the cause, whatever it is.
Okay. Thanks. And on a lighter note, during this corona season, no lockdown, you will be the better person to answer this question also. There is another pain which is coming up from the spouse. Which nerve to touch to remove that pain?
Very difficult question. so I'll tell you, go with a positive attitude, go with a lot of fun. So I think by the end of the session, I think I'll be out of the house if I tell the answer for this. So let's talk in person, Chaka. We'll do that in person. All right. Thank you.
Thank you, doctor.
Kanagaraj, can you read out the question? There are some questions in the chat.
Sir, Karthik Kumar
Okay.
sir will do it.
Okay, I just saw a question. I think he said he has a female patient post LSCS coming with pain. Post LSCS coming with pain, it can be scar pain or it can be sacroiliac joint pain. We can get rid of it by finding which pain is it, finding the cause of the pain, and trying to treat the pain. He's a clinical researcher who sent this message. I think I would answer this question now. And see, I wanted also to add, there are a lot of patients. I don't know how many of you are aware, there is something called painless labor analgesia, where now delivery is pain-free. There is no myth like a patient should undergo pain during delivery. But now there are a lot of technique, golden standard rules for giving painless labor analgesia. So people who are going in for delivery can opt for this, tell your anesthetist or call us. We'll guide you how to go with that and put you to the right.
Yeah, good evening, doctor. This is Sitaraman here again. I have one more question for you.
Please.
Yeah, I want to know. My son frequently has this cramps he gets, while asleep, sometime
Okay.
early morning, etc. So at least once in a month he has, once like that. One, I just like to know what could be the reasons for this and what preventive things we could take. That's one. Secondly, when you get such a pain, it's obviously a little severe. What could one do at that point in time to alleviate the pain?
I know. See, cramps is common. It's not only for young age group. It comes for everyone. But we need to find whether he had played or he had gone for a severe play and didn't have much of hydration, which causing the cramps, which can dehydrate the muscles, which in the night can cause cramp. So that one can be reason. Another one, if it is really frequent getting the cramps, you need to just do an EMG, something called EMG, and then find out which nerve is really troubling him, causing this. So either these two can be the cause, but usually if they are very well hydrated, try to hydrate them before they go to sleep. They're usually fine. Sorry, your second question was?
Yeah. So once when you get that pain, is there something you could do immediately to get an instant relief? Is there any posture or any thing you could do?
Okay. Okay. Suppose if it's going to be in the cough, just a cough stretch will definitely be fine. On the thighs, there is a stretches for that too. So that is all. You don't have to take medication. Liquid water and try to stretch it. It'll settle down. The cramps is only due to contraction of muscles. So if you try to stretch that and they get relaxed and you find. So nothing else. No medication will be needed. Don't try any medication for this thing. And he's young. He can do things on his own.
Okay, right. Thank you.
There's a question from Altab, a clinical researcher. He has many female patients who complains of back pain post other things, and he wants to know your view on this.
This is common for the post-op, like let's say surgeries. It can be a scar pain which is giving pain, or it can be something called sacroiliac joint, sacrum and the ilium joint. When they contract during pregnancy, that can give cause post delivery. So these two can be the cause. If we found out what is the cause, then we can always be able to treat these.
And another question from Jayabalan Subramanian asks, chiropractic choices good for spinal and joint pains?
Right. Okay. So see, chiropractic aligning the spine and joint, which is scientifically, I don't have much idea, but I know patients who have gone that have benefited. It's a holistic approach. If anything is going to happen without giving a medicine or injection, I'll definitely ask them to try it out. There's no harm trying things out. It can be good. If the pain gets severe, I don't think you should continue with it. But if you're getting okay, please try it. And anything without medication should be fine.
Dr. Madhan, I have a personal question now. See, this regarding pain management. Do you have actually the age-wise categories? Because when you grow up, actually you will wear so many muscles and bones will be in damage. So many things will happen in your body. But do you have treatment according to their age and the category of the? See, for example, if you say the 60 plus man can be stronger than a 60 plus man in some other category, right? So how will you judge about the pain management? For example, I can bear the pain of any wound, but at the same age, the person actually maybe very sensitive to small prick of pin. So how will you treat them then?
This is a very good question. See, like you're seeing all 5 fingers. You think all 5 fingers will be together. So every patient is like this. Every patient is different. Every patient will have different capacity to bear the pain or different tolerance towards pain. Somebody might be tolerating more, somebody might be tolerating less. But when their tolerance are less, it is not that they are purposely doing it. Their natural tolerance are less. So we always like to go each patient as an individual. We don't compare with one patient with other patient. That patient could tolerate, you couldn't tolerate. No, young baby or a youngster can tolerate more pain or he cannot tolerate pain. It depends, or old age. So it depends on how the patient tolerance level is, which is individual. It changes with the individual. So we cannot say, or we cannot tell this patient or this age group will have so much of tolerance. Or this age depends on. If the pain is severe, there is no age group there. Nobody is going to lie. When there is a pain, somebody is going to tell us, yeah, there is going to be pain. When there is no pain, nobody is going to tell us, unless you want to quit the office that day, watch a match or something like that. Apart from that, it's very clear. When there is pain, we need to treat them and get them out.
Okay. And the Gilbert James asked one question. His friend of his actually saying pains about a lot of, but it's not serious pain, but he still said always pain is there in his body. And how to get rid of that actually, because when it's not serious, actually when the pain is there, then how to treat them?
Yeah, see, common problem of the patient we have seen this pain all around the body. One common thing is their bone pain. This is what will cause pain all around the body. The common cause for this vitamin D deficiency. So we don't take adequate vitamin D naturally. When we don't go, nowadays we used to go play out cricket in the sun, come back only in the evening. All the stores have gone. People are all indoor now. The office, everything is indoor. We don't get exposed to sunlight, and more we don't take vitamin D intake of any supplement, vegetables or anything. So that will be one main cause. We're going to check the vitamin D. If it's going to be less, supplement the vitamin, and it takes 3 months to correct, and this pain will definitely go off. This will be the common pain for getting a whole body.
Okay. And one more question from Jayalakshmi Jayaraman. How does yogic breathing exercise affect pain?
Okay. See, breathing is another form of your physio, your mind control, your positiveness, mindfulness. It's all the same. So whatever word I put it as, it is all the same. So when you do that, you definitely get rid of it. So sometimes we give mindfulness in different ways. This mindfulness can be due to breathing, can be due to various methods. Yoga also can. You can divert your mind. Someone talking with you. Music therapy can do that. We have introduced even pet therapy for people of pet lovers who can come pet so that their mind is diverted. This can be a good pain relief. So breathing definitely will help them. So it will increase their good hormones coming out. A lot of factors will be involved, and they'll feel good and feel okay.
Okay. And regarding any pain for that matter, actually, if it's long term, if somebody ignores the pain, for example, I had a pain in my toe. The problem is actually when we visited the doctor, he told me that actually you need to undergo a lot of tests, and he found that actually I have flat foot. And he suggests me a chapel actually where I can use that for relieving that my pain. But when another doctor, actually the same rheumatologist, they told me in different hospital, told me that actually it is nothing doing with chapels and all. Even you don't require any medicine, just to do the physiotherapy. And even I don't suggest actually it will relieve your pain. But he told you need to ignore the pain. What is meant by that, ignoring the pain?
Ignore. If it is very severe, you can always treat it, like wearing chapel or whatever ways it will be. But if it is less, you can tolerate it. As I said, mindfulness is try to avoid getting that sink into mind. But if it is really troubling your walk, if it's really troubling your lifestyle, this is what exactly I was saying. The quality of life, what we need is without pain. If they're really going to trouble you, then treat it accordingly. Whether it can be a chapel, can be physio, rehab, it can be a lot of ways. It can be a lot of ways. I don't mention, I don't know what's the history. It can be a lot of ways, and both the doctors are right. So one has given you chapel, other one said don't do that. Both are right. I don't find fault with them. Both are right. So it depends on how we take it. If the pain is not going to really trouble you much, I think we can go ahead and do a normal lifestyle.
One more question from Vinod Kumar. Many ladies in Tamil Nadu may say that kai kaal kodachila irukku, and some people say that it's a psychological. Avanga mindset அப்படி இருக்கும் அப்படிங்கிற மாதிரி சொல்றாங்க. இது வந்து மைண்ட் தானா இல்ல வந்து நிஜமா பெயின் இருக்கா உங்களுக்கு? இது சம்திங்
கண்டிப்பா இல்ல. யாருமே, நான் தான் சொன்னேன், யாருமே பொய் சொல்ல போறது இல்ல. வலி இருக்குன்னு யாருமே பொய் சொல்ல போறது இல்ல. See, the problem is kai kaal kodachalungiradhu because see they don't have adequate nutrition. And our things usually our tradition is we let husband have, children have food, and finally it comes to the ladies. They have very little. They have very little nutrition. This is what is giving them pain. It is not that they are lying. They are working for it. This was the times when I am telling, which has been followed now. It's like a myth. It's being followed, and they keep doing all the household work. It is absolutely. It is not a lie. They'll be telling the truth. Just supplement them with all multivitamins and good food. All this will go. More than that, love and care for them definitely will help. I think Vinod. I think I answered your question.
Shankar sir is having another question.
Yes, sir.
Hello, Doctor. Good presentation, Doctor. Really appreciate you.
Thank you,
And
sir.
the point I would like to drive here is you have been talking about holistic approach, where normally the other doctors don't even talk about it. And the point is here there is all traditional way of working, like Varma, Varma is the points, where to touch the points, and that is more also something I
Correct.
could correlate with your pain management. And what are the
Correct.
other holistic approaches you recommend for people to take it up? And how is the way you are trying to communicate to your patients?
Sure. So, holistic approach, you see, first we don't go for medication, sir. We always try to go with rehab. With rehab, holistic approach like yoga, we ask them to do yoga. Yoga is another form of physio with breathing. And we try to do meditation. We try to ask them mindfulness. There's session something called mindfulness where we can do all this. Doesn't involve any medication. They have to sit or they have to lie down for half an hour and try to get. And we have music therapy coming up. We have vibration therapy, music therapy, aromatherapy, and we are including hydrotherapy also. So hydrotherapy physio doing at land is difficult, or in the normal room is difficult. But when you do it in the water, you feel light and your muscles get stretched better. So we are coming up with hydrotherapy. Also with hydrotherapy, we will the certified hydrotherapist who can help them, who will be inside with them with the pool and try to stretch them, which will give them very good relief. And apart from that, as I told you, we are coming out with pet therapy also, where people, animal lovers, can always enjoy the being with the companion pet and try to get. So these are something which we are coming up with, and all these things we are coming with online. So yoga, meditation, mindfulness, counseling, physiotherapy, all this we are coming at online. Whichever doesn't need any physical, we're coming it online and trying to get them being relieved on.
Doctor, how about the Varma therapy, Doctor? What is Varma?
Varma
And,
therapy, yes, Varma therapy, there is not much people known on, but it's very good. Varma therapy is very good. And really trained people, proper people, if we can get rid of the pain, is that's nothing like that. Again, see, we do with injections, as you said, they do with the pressure points. With pressure points, the same thing, something with the same thing. We have nothing against it. Everything is good. So if there's no medication involved, and the patient is going to get relieved, that is something good. And being something which is from our native India, there's all this therapies. I think we should encourage all this to come. Apart from taking medication unnecessarily spoiling your health, this will be a very good for the future.
Doctor. Thank you, Doctor, for your explanation. Thank you.
I think one more question actually before ending the session. This Alta once again is asked one more question. It's regarding premenstrual symptoms. Most of the women take self-medications in this particular category. So though it is normal, it seems to be like a majority of the population faces this issue. How to do it within home.
True. So this will be involving a gynecologist and as pain management patient with them. So it can be hormonal changes. We need to check whether it is anything to, or it can be endometriosis, something like cyst in the ovaries. So a lot of factors are there. If you're going to find the factor, correct those things, this will be normal. And we have treated patients with all the symptoms, and they are doing very well. So it is not that they have to suffer with the pain whenever they have a maintenance time. So it gets off. They have to believe in themselves, and we are here to help them out to get rid of.
Thanks, Dr. Madan. Actually, it is like you're not talking about the one segment of the medication now. You are talking about the holistic part of the medication. So that's good actually, because in a few other sessions we are talking about how to integrate all the segments. No, so many things are there uh, in our way of life. So people are talking about one segment and trying to treat relief from that particular segment of medication. But when you're trying with holistic approach, definitely the so many people will get relief from your kind of treatment. All the best in your endeavor, and thank you for your wonderful session.
Yeah. Thanks for inviting us for being a part of such a wonderful forum with all the learned scholars here and professors and senior people. And I was about to tell about this pandemic, what we are going through. So please stay at home, stay safe, love for others, care for others, and have some social responsibility. One of the talk I heard 2 days back when Dr. Rupa ma'am was telling that there is no social distancing in school. You can always tell them. So when you want you and your society to be healthy and happy, you can tell them, please have a social distancing within us, and no harm now. And please be safe. Stay at home. Don't step out unless it is really necessary. And for treatment, we are all online. So please do consult. And we can this will pass off, and be positive. Enjoy life.